Barlow Respiratory Hospital is a long-term acute care hospital with 3 locations in Los Angeles, Van Nuys, and Whittier, and we serve patients from all over California. Barlow is appropriate as a next level of care if your loved one has experienced a long hospital stay or a stay in the ICU. At Barlow Respiratory Hospital, your loved one will be surrounded by a team of healthcare specialists and will be seen by doctors every day. All of us at Barlow work together. We like to say we are one team with one goal: best outcomes. For critically ill patients, a hospital setting like Barlow Respiratory Hospital is often best. Our doctors are on site, available 24 hours a day, and our nurses are always on hand to provide care. For patients and their families, the recovery journey is often complex, and we know it can be difficult to adjust to different settings and different ways of doing things. At Barlow, your health team includes doctors, internists, pulmonologists, cardiologists, critical care and other specialists, as well as registered nurses, licensed respiratory therapists, speech-language pathologists, rehabilitation therapists, and registered dietitians. Often, the first person families want to see is their loved one's nurse. Our nursing team includes registered nurses, wound care specialists, and critical care specialists. And, to ensure our patients receive the highest level of care, we only hire registered nurses. At Barlow Respiratory Hospital, each team member contributes to patient care. Our rehabilitation (REHAB) team meets with each patient and family soon after admission to assess the patient's abilities, needs, and goals, and to prepare an individualized rehab treatment plan. For patients who come to us for ventilator weaning, our Barlow therapist-implemented patient-specific TIPS weaning protocol is nationally recognized for helping decrease dependence on a mechanical ventilator to breathe. Our protocol includes a daily assessment by our respiratory therapist to determine readiness and ability. Not all patients are able to be weaned. It's also possible that a patient could be discharged partly weaned, maybe only on the ventilator at night, or may even be discharged still ventilator dependent. Sometimes there is a bit of back and forth to the process, but no matter what, we work together as a team to achieve the best outcome possible. Our Barlow team also includes social workers who provide patients and their families with counseling, resources, and emotional support. And case managers who focus on referrals and discharge planning to prepare for the next level of care after Barlow. Our team focuses on preparing each patient for the next level of recovery, and we'd like you to be included throughout. Family meetings are designed to help you understand how your loved one is progressing and what their needs might be after Barlow. During this time, it is important to remember that recovery is rarely a straight line. Some setbacks can be expected and are natural. Our mission is to have a positive difference in the lives of our patients to achieve the best outcomes and most complete recovery possible. At Barlow, we work together to meet each patient's unique care needs. Every patient receives an individualized assessment to develop a treatment plan that includes discharge planning. Our team works to prepare for the next step in recovery. That may be discharge to another hospital for continued rehabilitation, a non-hospital lower level of care facility like a nursing home, a skilled nursing facility, a subacute facility, or maybe even a return home with healthcare services. If you have questions at any time during your stay at Barlow Respiratory Hospital, you can ask the charge nurse for help. We want your experience to be as positive as possible. We know that some things will be different. You may wait longer for some services, or you may have questions about procedures or treatment protocols. If your question or problem is not resolved, please ask to speak with the nursing manager. You can also file a complaint or give us a compliment by filling out the forms available at the nursing station. Barlow Respiratory Hospital. One team with one goal: best outcomes. If you have not already visited us, we invite you to take a tour of any of our locations in Los Angeles County. For more information, contact our admissions information line at 833-4-BARLOW or online at barlowhospital.org.